Hello, I'm Deepan Shah, the Medical Director of Cardiac MRI here at Houston Methodist DeBakey Heart and Vascular Center. And I'm very pleased today to have Dr. Anne-Marie Valente from Boston Children's and Brigham and Women's, who presented grand rounds on the long-term outcomes of patients with congenital heart disease. Dr. Valente trained in adult and pediatric medicine as well as adult and pediatric cardiology at Duke University, and she's now currently the Associate Professor of Medicine and Pediatrics at Harvard Medical School. So first off, Anne-Marie, welcome.
Thank you.
To Houston. And why don't we start off by asking you, obviously you've had a very interesting career background and you've done a lot of training. Maybe just tell us a little bit about your training and what caused you to decide to pursue this kind of pathway of endless training.
Thank you. It's great to be here. I think that as I was going through training, I was really invigorated by watching the children grow up with heart disease and felt like a good pathway for me would be to learn about both the complications and the struggles that they have as children and their successes, and then follow them through adulthood. And I was fortunate because in medical school, I worked with a pediatric cardiologist who, although she was trained in pediatric cardiology, saw all of the adults in Vermont as well that had congenital heart disease at the time. And in working with her, I realized that was a potential. So I tailored my training to make sure I could get the experiences I need to do what I do.
And how many people are there in the U.S. that have done kind of this combined pediatric and adult training in cardiology?
I don't know the specific number. I think it's a fairly small group. People get to the end point of taking care of adults with congenital heart disease through different pathways. But at the time that I did it, there were several other people that are now around the country as well doing it. The newer guidelines through the American Board of Internal Medicine advocate for people to go through either medicine pediatrics or medicine pediatrics and then choose either adult cardiology or pediatric cardiology and then do an advanced 2-year fellowship on after that to do adult congenital heart disease. So that's the current pathway people go through.
Okay, great. So one of the things you touched on during your grand rounds was this international registry that you worked to put together. And I think, you know, for a field where there's smaller numbers of patients, I think pooling data together to generate registries like this are very important. And I thought maybe if you could share with us your experience of the steps you went through to set this up, what's involved, and obviously it looks like you're already producing results from it that hopefully in the future will continue to improve the management of these patients. So share with us a little bit about kind of the workings of setting this up.
Sure, thanks. I'd love to. I was really fortunate in that when I first moved to Boston, Dr. Gava, who was my mentor at the time, wanted to do more research in patients with tetralogy of Fallot. And what we were limited by, as many centers are, is just limited numbers of patients with heart outcomes, because in general, patients do very well, which is terrific. But we thought that by working with collaborators at other large centers, we may be able to develop a cohort of patients that over the larger numbers had more outcomes that we could look at. So that's how we initially set it up. We basically went to people that we had worked with and said, solicited their interest, and were able to form first a scientific oversight group from one person at each center to make the initial planning of it. And then we developed a very comprehensive data set of case report forms about what exactly we would need. We had images all transferred to Boston, so we developed a core lab for imaging, and we also have a statistical core lab in Boston, and that was all set up prior to any transfer of data. And we, of course, got institutional review and ethical approval at each of these institutions and just identified patients. And since we started that, we've been able to add more patients and update outcomes on a serial basis, which has been great. We've added new collaborators from those centers, and now that we have this larger group, are starting to ask different questions.
Mm-hmm. And how large is your registry currently?
So the registry right now has over 1,500 individual patients in it, and well over 2,000 MRIs in it. In order to be in the indicator registry, one of the inclusion criteria is you had to undergo cardiac MRI. So that is primarily the group of patients that we're looking at.
Right. Well, that's phenomenal. I think it's, you know, I mean, I think, you know, generating the data that's going to help really change the way we manage patients in the future, I think is key, and I really commend you for that. So one of the other areas that you've, or I guess niche that you have also, is taking care of women who are pregnant with heart disease. And do you want to tell us a little bit about some of the challenges that you face, interesting scenarios you've come across, and just a little bit more about that?
Sure. It's an exciting time to be in medicine, and the opportunity to care for women that are pregnant, that have had some type of cardiac condition, is a really unique opportunity. I'm very fortunate that I work with a very strong group of maternal fetal medicine doctors at the Brigham and Women's Hospital, and they have a whole team, as well as our team of cardiologists that really spend a lot of time thinking about these patients. And what we do is we have a standardized protocol when women come in and see us, that we designate their level of risk based on prior studies about what their risk may be. And then their amount of visits and their amount of testing is based on their individual risk level. And we meet once a month as a group, and we also have the obstetric anesthesiologist with us, and we come up with planning for delivery in the postpartum period, such as what type of monitoring they'll need, how soon they need to be seen afterwards, and things to anticipate. And as far as the overall group, I mean, most women do very well, but we do anticipate for issues. So we have had women deliver in the cardiac OR. For instance, one woman who had severe prosthetic valve, aortic valve stenosis, and was fairly asymptomatic up until the later stages of pregnancy when she developed symptoms. We had her deliver vaginal delivery in the cardiac OR, but we had the TAVR team there. We had the surgical team there in case she needed to go on bypass. So it was quite an event. Thankfully, she delivered well and then recovered for a few days and then went for open heart surgery to replace her bioprosthetic valve.
Wow, that's amazing. Yeah, I mean, I think it's, having kind of this multidisciplinary team together, I think, is key. And that seems to be the way that the field of medicine is evolving in general. So tell me, what do you think right now as a congenital heart specialist, what do you think are the greatest challenges currently? And where do you see on the horizon in the next 5, 10, 15 years?
Well, I think the horizon is just open with possibilities, but there are a lot of challenges right now. So in caring for adults with congenital heart disease, one of the largest challenges is just identifying the patients. Many patients that were operated on when they were little may not understand that they need lifelong care. They may be seen by people who do not know the potentials for worse outcomes in these patients. So just identifying who would be appropriate to come back and be seen by adult congenital specialists. I think another huge challenge is the insurance issues that come up with patients. So patients may live in an area where they do not have any access to specialized care, and yet they're unable to get specialized care because of financial or insurance constraints, and that's really unfortunate. Despite the amount of time and effort we spend trying to get patients approved, we oftentimes fall short. And my hope is that with newer regulations, we're going to be able to provide appropriate care to the patients that need it. I think there's many potentials in the next 5 or 10 years for the field as we get more organized in how to care for patients. I think one of the challenges has been, because all of these programs have kind of developed homegrown, there's not a sense of how often we should be seeing patients, how often to do testing, and then how to collect their data in a organized way where we can collaborate to figure out the answers to some important questions. But now there are, in the past decade, really groups that have developed who are collaborating and who are trying to make a difference as far as thinking about how to do this more as a larger team. And the guidelines, which were originally published in 2008 to care for adults with congenital heart disease, are being revised, and they should be out in the next year. And I'm hopeful that they'll provide more granularity to how best to care for some of our patients.
Great. Well, I want to thank you very much, Dr. Anne-Marie Valente. Very much enjoyed your lecture here.
Thank you. It's a pleasure to be here.